歡迎大家嚟到今日。
Welcome to the press briefing. We have Dr. Albert Au, Principal Medical and Health Officer of the Center for Health Protection, and Dr. Larry Lee, Chief Manager, Hospital Authority. Dr. Au will give you an update on cases. Good afternoon. On the 3rd of March, for confirmed cases at the Center for Health Protection, there were confirmed 52,523 cases. The case number from 350564 to 4030686. 4,552 cases were reported through the Hospital Authority. 2,539 cases were reported through the public laboratory. For the remaining 45,432 cases, they are confirmed by private laboratories. And of these 50,000 plus cases, 11 are imported cases. For the remaining 52,112 cases are local infected cases. And so far, for the fifth wave, there are a total of 390,449 confirmed cases. On data and on genetic analysis, for 2,539 samples, genetic analysis was done by the public laboratory. No positive L452R samples were found. For 1,653 samples, they tested negative to L452R, so they should be Omicron samples. For the remaining 590 samples, they have yet to be tested, and for 292 samples, there's not enough viral load for genetic analysis. And on outbreaks involving homes yesterday, another 46 homes have seen outbreaks or infected cases. 34 cases involve residential care homes for the elderly, and 12 homes are residential care homes for the disabled. And altogether, there are 730 cases. 522 cases involve residents, 187 cases involve staff members. And 11 of these homes are on the Hong Kong Island, 7 are in Kowloon, 7 in New Territories East, and 21 in New Territories West. In total, for the fifth wave, 755 homes have seen outbreaks or infections. As for residential care homes for the elderly, in Hong Kong, there are about 72% of the homes that have seen either cases or outbreaks, involving about 9,800 residents. That accounts for 30% of the total resident population in these homes. And then there are about 2,850 staff members of RCHEs have been infected. They account for about 9.5% of the total number of staff members in these homes. And then for homes where there have been infections or infection cases or outbreaks, of 302 homes, or about 53%, have 10 or more cases. As for death cases, there are about 680 death cases involving home residents. For R6D, residential care homes for the disabled, about 60% of all such homes have seen infection cases or outbreaks, involving about 3,100 residents. That's about 70% of the total resident population in these homes. And then there are also 1,030 staff members of these homes who have been infected. They account for about 9.8% of all the staff members in these homes. And then for about 100 RCHDs, or 56% of the total number of homes, have seen 10 or more cases. Now, so you see that for RCHEs, we have seen rather serious outbreaks. So I must appeal to all residents living in these homes to be vaccinated. This will prevent serious cases, complications, or deaths. For vaccination for RCHE residents, the Department of Health has consulted experts and chairman of the scientific committee. So for residents who take the Sinovac vaccine, the interval between the first and second doses could be reduced from 28 days to 21 days. For BioNTech, the interval remains at 21 days between the first and the second dose. For recovered residents, after 4 weeks, they can be vaccinated again. That's all from me. Dr. Lee, please, about the hospital authority. Now, there are 7,306 confirmed and preliminary positive cases at the different hospitals. Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority, Infectious Disease Center, AWE Community Treatment Center, and so on, and public hospitals. And about 1,100 patients are in the Penny's Bay Community Isolation Facility. As at last night, there are 54 in critical condition. 37 of them have no vaccination record. 85 patients are in serious condition. 59 of them have no vaccination records. And as at midnight today, in the past 24 hours, 136 patients passed away because of COVID-19 infection. 76 males, 60 females aged between 29 and 102. And for patients who passed away, 73 came from homes. 97 did not have any vaccination record. 17 had 2 doses. 21 had 1 dose. For 131 residents, elderly, there are 131 who passed away were aged 60 or above. Now, I want to talk about 3 younger patients who passed away. The first one, 55-year-old female. She is a chronic disease patient. She lives in a home. On the 2nd of March, she went to the Caritas Medical Center, a accident and emergency department. She had pneumonia and shortness of breath, and at around 3 a.m. on the 3rd of March, she passed away. Second one, a 57-year-old female. She is also a resident of a home. She had record of cancer. She, on the 23rd of February, she went to the Queen Elizabeth Queen Mary Hospital A&D for treatment, and then she passed away on the 3rd of March. The third patient is a 29-year-old male. He also lived in a home for the disabled. He went to the A&D ED of Princess Margaret Hospital on the 23rd of February with fever and shortness of breath, and then he was admitted to hospital, and then he passed away on the 3rd of March. Now, because there's some lag in data between the 21st of February and the 2nd of March, there are 23 death cases not yet announced, aged between 16 and 104. 23 males and 3 females. And for the 5th wave, so far 1,341 patients passed away. Most of them were elderly. And then yesterday, 494 patients recovered and were discharged. And the occupancy rate of our isolation beds is 86.68%. About 60 patients were screened in with COVID upon admission. 130 patients are listed as close contacts. Among staff members, about a total of 6,380 staff members have confirmed cases, but about 600 of them have recovered and been back at work. Now, for the Kowloon West cluster, there's some information about that. Starting from next week, the medicine ward will only deal with emergency cases. For non-emergency treatment that will be rescheduled. And then also for outpatient clinic, they will only dispense medicine, but there won't be any consultation sessions. As for the less emergency cases, the hospital arranged for a later appointment date. For the general outpatient clinic, the app for making appointments will be suspended, and also telephone appointment will be suspended. By redeploying our by adjusting our services, we'll be able to send more staff to the front line to fight the epidemic, and also we want to reduce the number of visitors going to hospitals. Now, for non-emergency services, so most will be suspended, and patients could approach us if they need any assistance.
The floor is now open to media questions. Please introduce your organization before you ask a question. The journalist in the gray shirt. I'm from Now TV. 2 questions. First, previously, you said that the rapid test online platform will be completed within this week. Will that be so? Can you give us more details? Second question is for the HA. We know that the HA has ordered MSD drugs. So what are the criteria for prescribing the drugs? Do you have sufficient stocks? And I know that only HA is able to procure the medicine. Now, if private hospitals would like to borrow drugs from you, would you lend them the drugs? And what factors will you take into consideration? About the platform for reporting RAT positive test results. Right now, the IT staff of DH are now preparing for the platform. Complicated technical issues are involved. And we anticipate that in the initial stage of the commencement of the platform, a large number of Hong Kong people will submit their personal information to us on the platform. So we would like to perfect the system as much as possible so that there will not be any teething problems and confusion caused. So when we issue the quarantine orders, isolation orders, everything will be done smoothly and effectively. And in verifying the identity of the Hong Kong people, we would like to make sure that accurate verification can be done. So that takes time. Now, as for the drugs, you were referring to the MSD drugs. According to the experts, we have procured the molnupiravir. So we would prescribe them based on clinical conditions. We are now prescribing them. We will monitor the usage and the supply of such drugs. We have established a mechanism to lend the drugs to the private hospitals. We will consider various factors, including whether they have any channels to procure the medicine themselves and also our stocks and inventory. So we make sure that the drugs are used on the right patients. So the reporter in the middle. At the back row. I'm from Cable TV. You said that patients who are recovered 4 weeks later, they can take vaccines. When did you update this? So is it the same for both types of vaccines? And people are scrambling for painkillers and antipyretics and so on. So if Hong Kong people cannot procure such drugs, are there any medicine which can sort of lessen the symptoms? About vaccination for the elderly, well, the outbreaks at residential care homes for the elderly are very severe. And if residents are infected, we see that the fatality rate is very high, higher than the ordinary citizens and elderly not residing in an RSHE. So based on this factor and also the current epidemic situation, the CHP has examined certain scientific data and also consulted the chairman of the Joint Scientific Committee. We unanimously agree that if the resident has not been vaccinated, after he has recovered, he can start taking the vaccines after 4 weeks. Now, if he has taken the vaccines, then he can take the vaccine 3 months later after recovery. That applies only to residents in the care homes, not on ordinary members of the public. And for paracetamol, according to this information, Hong Kong now has over 700 types of registered drugs which have an ingredient including paracetamol. And on the shortage of drugs in the market, the DH is already liaising with the suppliers and the manufacturers closely. And we are asking them to increase the supply based on the demands to meet with the local needs. The next question. Well, let's ask an English question. The lady at the back.
Thank you, doctors. I'm from Bloomberg News. Can I just follow up on the previous question? Has Hong Kong started molnupiravir COVID drug treatments in hospitals? And my second question is about the overflowing of bodies in public hospitals. Dr. Lee, you've mentioned that refrigerated containers are being sent to hospitals to help relieve the load. Can we have an update on how that is going? As well as the flow in public mortuaries. We're hearing that they've also been stretched to the limit with the amount of cadavers that they're receiving, and is there any relief in sight? And my last question is to just clarify the backlog of 52 deaths that was just mentioned. What was the age range, and can you talk about the conditions of the younger patients of the 52 deaths? Thank you.
All right. I try to answer all three questions, and about the public monitoring, maybe let Dr. Au to supplement. Okay. For the new, the anti-viral drugs, we talk about the molnupiravir, and actually it has been start clinical use in HA Hospital. And regarding the overflow of the corpse, and we have order the refrigerated containers, and actually they some of them are arrived, and actually some of them are pending arrive, and that will be in 1 or 2 days, and actually some of them are actually in use. That will provide an extra capacity of about 500. And for the what is your last question? Sorry. All right. Okay. Okay. Mm-hmm. All right, okay. For the backlog, that was dated between the 23rd of the February and also the 2nd of the March, and there's a 52. The youngest one will be the 56, and the eldest one will be the 104. Let me elaborate a bit more about the 56-year-old lady. The 56-year-old lady also got long-term illness, and she arrived the Pamela Yeo Leathersall Eastern Hospital Emergency Department in the afternoon of the 1st of the March for shortness of breath. She was resuscitated there, intubated, and admitted to the medical ward for further management. But however, she eventually passed away on the 2nd of the March, the night time.
For the capacity of the mortuary, the Department of Health has increased the spaces in our mortuaries, and also we have liaised with the private sector to increase the storage of our dead bodies. Since the 1st of March, we have borrowed about 45 spaces from a funeral home of the Tung Wah Group of hospitals for temporary use, and also as we have also borrowed about 40 spaces from 2 nursing homes, and also since the 4th of March, the Hong Kong Anti-Cancer Society has borrowed some spaces for use by the Department of Health, and also another nursing home will also borrow some spaces for use by the Department of Health since next week. The Department of Health has also set up some temporary cold storage converted from containers in our Sha Tin Fu Shan mortuary for use since the 2nd of March. And we will increase the number of cold storage containers to 6, and the total capacity for storage will increase more than 300. And if necessary, we will also continue to increase the number of cold containers for use.
下一題，問多條英文問題啊，呢邊。
Another English question over there on the left.
The SCMP, So the first question is, Professor Lau Yulong has urged recovered elderly COVID-19 patients to get vaccinated, and the previous guidelines were to get the jab a few months after recovery, but now Professor Lau has said they should get the shot as soon as possible. So what should people do, especially given that there are differences in guidelines now for care home residents? And will it be a waste of vaccine to get the jab so soon after recovery, since people will have some immunity? My second question is on oxygen supply. So there are some hospital staff saying that the supply of oxygen is running out. So can the hospital authority give us an update on the issue and confirm if there is a supply issue with the hospital's central system? Thirdly, of the genome sequence deaths so far, how many were of the Delta variant and how many were Omicron? And what is the case fatality rate for Delta and Omicron deaths respectively? Thank you.
Maybe I answer the second questions about the oxygens. We have a significant increase in patients who need oxygen support, no matter in the hospital ward or maybe in the emergency department. I have to clarify that our central supply, there is no problem at all. And our situation is we have some patients who is being cared in some area without central supply. So we have to provide oxygen for this patient in need with our cylinder oxygens. And as I mentioned before, we have some turnover hiccups about the cylinder oxygen. Now we are working on it. We try to enhance the turnover with some logistics issues, working with the company, and also we aim at some repositionings of the patients, so that for the patients who in need for the oxygen will be can access to the central supply. I have to emphasize that there is no evidence of any lack of oxygen supply in any hospitals.
For the vaccination schedule among residents of residential care homes for the elderly, after reviewing the scientific evidence and also data on the safety, as well as consulting experts and chairmen of the Joint Scientific Committee under the CHP, the CHP has decided to shorten that we will have two measures. First of all, for the vaccination schedules for residents in residential care homes for the elderly, the interval between the first dose and the second dose will be shortened for Sinovac. For Sinovac vaccination will be shortened from 28 days to 21 days, so as to boost up the so as to allow the residents to complete the vaccinations as soon as possible and to boost up the overall immunity for residents of RCHEs as soon as possible. And secondly, for those who are unvaccinated, if the residents were infected with COVID-19 previously, they need to wait for 3 months to receive vaccinations. In view of the current situation, those recovered from COVID-19, for the unvaccinated residents who have recovered from COVID-19, they can receive the vaccinations as soon as 4 weeks after recovery for both Sinovac vaccinations and also BioNTech vaccinations, so as to boost up their immunity as if they have been infected, the immunity may not be enough to prevent further infections. For the death case, the Public Health Laboratory Services Center have been performing whole genome sequencing on the viruses to identify the strain. As up to last week, the PHRSB has completed whole genome sequencing on 47 cases, fatal cases, and it was found that among the 47 cases with whole genome sequencing completed, 42 belong to Omicron BA.2, and another 5 death cases belong to Delta. And whole genome sequencing of other specimens from fatal cases is ongoing.
下一題，前邊呢位，中間呢位。
In the middle. Good afternoon, doctors. I'm from TVB. Well, just now, some other reporters asked you about the platform for registration of RAT positive result. When would the platform be launched? You said you are still fine-tuning the system. Could it be launched within this week? So many people are doing rapid antigen tests and they test positive every day now. So who will have priority? Are you considering the infected patients first, or are you putting priority on improving the system? So would you launch the system first and then enhance it later? And for people who need a certification, will only those who test positive will receive a certificate for confirmed case? Now, there is not yet this platform for people to register their RAT positive result. For people who test positive this way, how can they obtain this certificate of a confirmed case, and how do they apply for a sick leave certificate? And also, we're seeing an increasing number of confirmed cases each day, more than 50,000 a day. Have we reached the peak yet? And what is the infection control strategy of the government? Would it be changed? Because definitely we could not achieve zero infection in a short period of time, but then you say we won't live with COVID. So would there be a better prevention and control strategy? On the use of rapid antigen test, the Food and Health Bureau has announced that starting from the 26th of February, RAT test result, positive test result would be accepted evidence as confirmation of COVID-19 infection. Because we have tested many of the RATs and we find that the results are inaccurate, so the chance of a false positive is slim. That's why we advise the public that if they test positive with RAT, the case will be confirmed as will be a confirmed case, and the person will have to isolate at home. The person must not go to work or school. Family members have to stay in the same household as well, and then they have to observe personal hygiene. And where the household condition allows, the infected person should stay in a room separately. And if the person leaves the room, it's best for him or her to wear a mask and to avoid any contact with other family members who have not been infected. So this is what someone needs to do if he or she tests positive using an RAT. And now we're preparing a platform so people could give us their information on this platform. Well, there is need to have confirmation of identity on this platform. That is, people will have to submit their ID card and other form of identity certification, and they also have to upload the photo of the positive RAT test. So we have to consider how we could confirm whether that person is actually the patient, him or herself, and not someone else using their identity without their knowledge. So we need to address all these details. The colleagues of the IT colleagues of the Department of Health are working on this platform. I'm afraid I'm not able to give you an exact date on when this platform will be launched. We will continue to test the system. Hopefully when the platform is launched, it will be ready for use, and then there won't be any problems involving privacy issues or identity theft. And when we may also do random sampling for reported cases, so they would have to do PCR tests and so on. But so we need time to make all the arrangement. Now for people who test positive with an RAT, and when this platform is launched, they could still report their case retrospectively. They need just only to provide their personal date particulars retrospectively. There will be a retrospective period, and that is from the 26th of February. For people who have used RAT and obtained a positive test result, they could use this platform to register their cases. We'll be announcing the details when the platform is ready. And as for the proof or certificate of confirmed case, it will be given to them later. So they just need to fill in their ID card details and they'll be able to get this certificate.
Sorry, the speaker is not coming through. So it's not a technical issue. Well, there are a lot of technical details to be hammered out. So our technical staff of ICDIC are now working everything out. So once the platform is completed, we will roll it right away. But I don't have a specific timetable at the moment. Now, I didn't answer your previous question about prevention and control strategies. Now, we have numerous cases these days, and it seems that the trend is on the upward side still. In the past couple of days, well, there were over 50,000 cases every day, and we haven't seen the peak yet. And we still have to observe further, of course. And in recent days, a lot of people have taken the RAT, but not the PCR test. And so we haven't been able to grasp data on that front. So the current figures only reflect the results of PCR tests. So we need more time to observe the trend further. In any case, judging by the daily infection number, we can be certain that the epidemic is very severe and the prevalence rate is very high. So we still adopt the early detection, early isolation, and early treatment strategy. We try to identify and detect cases in the community as early as possible, isolate them and treat them. And we hope to cut down on the fatality rate and the morbidity rate so that the transmission chains can be severed as soon as possible. Only by doing that can we curb the further spread of the epidemic and cut down on the number of people who get infected. The report in blue. I'm from Dim Sum Daily. I have 4 questions. First, a lot of media reports saying that private hospitals refuse to take in COVID-19 patients. I would like to ask whether the government will invoke any legislation like the Emergency Regulations Ordinance so that the private hospitals can shoulder greater responsibilities. Media report also said that the private hospitals' refusal to accept COVID patients is that they lack negative pressure wards. Is it the case? Private hospitals, can they build some negative pressure wards? And then third question, at pharmacies or public hospitals, they are understaffed. Now, apart from the A&D, are public hospitals maintaining normal operations at other departments? The fourth question, the Qingyi makeshift hospital has been completed. What is the occupancy rate now? What is the utilization rate now? Thank you. Let me first talk about private hospitals. Right now, private hospitals are already helping out. They are taking on some appointed surgeries like radiotherapy, patients with coronary diseases, and so on. Now, over 70 patients in total have been transferred to various private hospitals. The number is increasing. We will keep liaising with private hospitals. Yesterday, we said that the CUHK hospital is also taking in COVID-19 patients. And the details are about to be finalized. So this is part of the PPP. And the Qingyi Makeshift Hospital is a community isolation center. A number of patients have already moved in, but I don't have the exact figures. It mainly takes in patients with mild symptoms. The next reporter, please. Well, the reporter in the front in blue, please. I'm from Ming Pao. Dr. Au said that the fatality rate of elderly in RCHA is higher than those not staying in RCHEs. Can you provide us with the figures? And then about vaccination for residents in RCHEs. Now, some RCHEs told us that there are really outreach service to vaccinate the RCHE residents, but then some private RCHEs, because of outbreaks, refuse to allow the doctors in. Do you know about this? Now, if RCHE is seeing an outbreak, can you still proceed with your scheduled vaccination program? And do you have guidelines for the private medical institutions on vaccination? Well, even if you have new guidelines and nobody is willing to let you in, you won't be able to achieve your objective. Now, my next question is for the HA. I notice that there are a lot more patients now staying in hospitals. Today, we have some 7,300 patients. But then the isolation beds utilizations, now, it used to be, the occupation rate used to be 90%. Now it's 80% or so. Originally, 30% of the wards will be treating COVID patients. Now the percentage is 50%. Is that the right figure? Now you're using more wards to take in COVID patients. So does it mean that the utilization rate drops as a result? I have a question on the A&E department. Last week, we understood that the most serious case is that 280 patients will have to wait for 8 hours. Now, for QEH, over 400 patients are now waiting for over 8 hours. Now, you have been appealing to the public not to go to the A&ED lightly. So does it mean that your appeal has failed? And also the treatment of dead bodies. How many hospitals have already procured refrigerated containers? Okay, let me answer first. Over 7,000 patients are staying in public hospitals. Previously, I said that we have a total of 3,600 isolation beds, and we have hit capacity. Now we talk about 80%, 90% occupation rate. Is nothing but snapshot figures, because there has always been a turnover of the patients. So that's the situation of the figures. Our colleagues have been working very hard. Now, as for A&ED, they are at the front line, and they are under tremendous pressure. And I'd like to thank the A&ED staff for staying dedicated to their positions. We're helping them in various ways. First, on the wards, some wards will be converted to take in COVID patients. Previously, we said that we are going to add in some fans, and we are also trying to speed up the turnover so that patients can be discharged more quickly. Now, clinically speaking, if the patients are in stable condition, they can be discharged. And we will handle the home isolation in accordance with whether they have been vaccinated. Now, different hospital clusters will also coordinate among themselves so that certain staff member will be redeployed to help with A&ED. Now, whether it's the wards or the A&ED, well, we are actually transferring stable patients to community treatment center and community isolation center. So through various ways, we try to ease the pressure. Now, there are so many patients seeking medical consultation. Now, we have ordered several dozen refrigerated containers, and individual hospitals have been using them already. I don't have the figure now.
On vaccination at residential care homes for the elderly, well, the elderly population, of course, is older, and then many of them have underlying conditions. So if they're infected, then there is a high percentage of them who have to be hospitalized or who suffer complications or even death. As I mentioned, so far 9,600 residents have been confirmed with COVID infection. And so far there are about 70,000 people living in elderly homes. So That means close to 15% of residents have been infected. And among the death cases recorded, more than half, at least 680 death cases involved residents of elderly homes. Now, in Hong Kong, most elderly persons live in a community. Just about 70,000 of them live in residential care homes, but then they account for more than half of the death cases. So that's why they are a particularly high-risk group. Also in homes, perhaps because of contact with workers and residents, the disease may spread easily. That's why we're very much concerned about that. That's why the government has taken a series of measures. And there will be new measures too to speed up the vaccination rate of residents in care homes. Now, some may have the misunderstanding that if there are outbreaks or infection cases in the homes, then no vaccination could be administered. But actually, I would like to clarify it's not the case. Now, if in a home there's an outbreak or there are some infected cases, the other residents could still get vaccinated. In fact, there is an urgency for the non-infected residents to get vaccinated as soon as possible. So for residents who have not yet taken the jab, and if they are not infected, they could still receive the vaccine, and they should do it quickly, actually. And there is no need to test if the person is infected. As long as they have shown no symptoms and they don't feel unwell, then they could be administered with the vaccine. Now, of course, the Department of Health has launched a series of measures so that we could speed up the vaccination program for elderly residents in care homes. And then for those who've recovered, they could get vaccinated after 4 weeks of recovery. And also, for the interval between the first and the second dose of CoronaVac, it could be shortened from to 21 days. Sorry, speaker is not using microphone. Sorry, the speaker is not using microphone. Through the Social Welfare Department, we will hope to pass on the information. And also with our elderly health services, perhaps we could arrange for visiting doctors or others to vaccinate the elderly residents in these homes. On the right, the one with a cap, I'm from Ta Kung Pao. Well, the government actually encourages confirmed or infected elderly patients with mild symptoms to go back to the homes, but then over 750 homes have seen infected cases. Has that to do with this government's policy? Could the two doctors give an explanation, please? Second question about the Leave Home Safe app. Would the government still be deploying much manpower and resources to enforce the use of the Leave Home Safe app? If there is any violation, would you take enforcement action? Because you have limited resources now, can you actually do that? Now, for people who do not scan the Leave Home Safe app, how would you handle that? Well, you talk about elderly patients with mild symptoms. Maybe the elderly homes take them to our hospitals for treatment. We have a mechanism to do with that. There are clinical criteria to go by too. If clinically they are in stable condition, we'll ask them to go back to the elderly homes. But of course, it depends on whether it's possible. We won't compel them to go back to the homes. And also we have community treatment facilities at the Asia World Expo. We also have the North Lantau Infection Control Centers. We could handle elderly patients there. And of course, for those with poor clinical condition who need more care, we will keep them in the hospitals. On the Leave Home Safe app, we encourage the public to scan the Leave Home Safe app when they go in and out of premises. The advantage is that then there will be a record of where they have been, and if they have become infected, the Leave Home Safe app will help them to remember where they have been, when, and with whom. And then they could inform people who've had contact with them. These records will also help the Center for Health Protection with contact tracing. But of course, we have a huge number of cases now, and almost in all public premises, we are seeing cases every day. So we no longer send notifications because it's unrealistic to do so at this point, and also with such widespread transmission of the disease. We are seeing cases in almost all premises every day, so that's why there's no point of sending out notification at this point. But then it's good to get into the habit of scanning the Leave Home Safe app, because then it will help you remember where you have been, as I explained. And then through our electronic platform, we're able to see where infected persons have been to, and so on. If we find that there are major outbreaks or unusual circumstances, then we may need to issue compulsory testing notices. And then through the Leave Home Safe app, we will inform the public. So maybe because the epidemic is so severe, there seem to be cases everywhere. But then if there are unusual circumstances or major outbreaks in a particular premise, then we could still notify the public through the Leave Home Safe app. That's why the public must remember to scan the Leave Home Safe app as they go in and out of premises. And also, they should upload their electronic vaccination record to the Leave Home Safe app, and then it will be easy for them to go in and out of premises. From Orange News, the government expert advisor, Professor Ying Kwok Yung, said that we should only do the universal compulsory test when there are just a few hundred cases a day. Then it will work the best. So why is there still no announcement on the compulsory testing? Is it because there are differences of views among experts? Have mainland experts given their views? And then there's a report that there are about 30 bodies left in room temperature in Kwong Wah Hospital yesterday. You know, they were just left there on the ground. Did that really happen? Why did it happen? On universal compulsory testing, the government relevant officials already explained the latest situation. Within the government, they are still discussing the way to do the test. There's not yet a final decision, and there's no time frame yet. And of course, if we launch the program, there are various support measures that need to be implemented. We need to have sufficient testing capacity and isolation facilities, and also the various details about the actual arrangement. And once these details are fleshed out, the government will make an announcement at the first instance. On the storage of bodies, the refrigerator containers are being received, and some hospitals starting to use such facilities. So that should help to provide more spaces for keeping the bodies of the deceased. For the Food and Environmental Hygiene Department and Department of Health, they've been working really hard the past few days. They are using dedicated transportation teams to send the bodies to public mortuaries. And then the Department of Health will also be providing additional storage facilities at different locations that the situation should improve. Thank you.
The reporter in green at the back. I'm from Hong Kong 01. First, a question about care homes. Those in the sector say that those infected should be separated from those not infected. Are there any practical measures to do that? And what is the risk of infection within the care homes? Now, if there are outbreaks in the care homes, it's seldom these days that you would evacuate everyone in the RCHE. Now, how are you going to segregate the two groups of elderly, those infected and not infected? And for Kowloon West Cluster, what do you mean by emergency and non-emergency cases? Now, if a patient are doing follow-up consultation all the time, they can just get the drugs. But then how can they decide whether they can still take the usual drugs or the drugs that should be changed? Now, people say that they cannot get through the hotline all the time. And some people say that the consultations, follow-up consultations have been delayed again and again, and some have waited for over a year before they can get a consultation follow-up. You said that there are 6,380 HA staff have been infected, 600 have returned to work. So is this number 600 within the 6,380? Now, I might not be able to comment too much on about the segregation of the different types of elderly, but then we do have experts to help us out to make certain judgment. Now, for Kowloon West Cluster hospitals, emergency and non-emergency cases. Now, if a patient doesn't show any serious symptom and is just having a follow-up consultation, we consider that cases as non-emergent nor non-urgent cases. But if there are changes in their conditions, the patients may have to contact the hospitals. Now, for the 600 recovered HA staff, these are already included in the 6,380 figure. Now, as for outbreaks in care homes, when CHP receives reports of outbreaks in care homes, we would conduct the epidemiological studies. We would look into those affected, the residents and staff, and also the numbers. And generally, if residents have infections and they have serious symptoms, they should go to the hospital immediately. And through the SWD, we would also be contacting the clinical staff of HA to make an assessment of the situation of those affected and whether they need to be treated in hospitals. Now, if their symptoms are mild and they don't need hospitalization, then we'll suggest to the care home that, where possible, the affected residents should be gathered together and be isolated. And we would also ask that designated staff be deployed to take care of this group of residents. Of course, they have to adhere to the anti-epidemic, anti-infection guidelines. They should wear proper PPE, and they should not share the use of items in the RCHE. Now, normally, those staying on the same floor are considered as close contacts, and they have the risk of being infected. Now, for smaller RCHEs, the segregation of the different cubicles may not be that clear, so those living on the same floor are considered close contacts. And if that is the case, we would recommend RAT be conducted on all residents, and the positive cases can be detected soonest. Now, if major outbreaks happen in large RCHEs where a number of staff and residents are affected, we will ask the SWD to help with the evacuation. But now, these days, so many RCHEs are affected, and sort of isolation facilities may not meet with our prescribed requirements. And normally, we would just be asking the residents be isolated and quarantined in the RCHE. The lady at the very back. Last question. I'm from Economic Times. First, Dr. Au. These days, there are quite a number of buildings subject to compulsory testing. And today, well, over 1,000 cases have been found in a number of buildings subject to compulsory testing. So can all these infected residents be sent to quarantine? Now, how long will it take for all of them to be sent to quarantine center? Now, you said that after the elderly residents in RCHE can take vaccines after they have 4 weeks after they have recovered. But Professor Yuen Kwok Yung said that that should be done as soon as possible. So if it is done within a month, what are the advantages or disadvantages? And you said that the HA has procured oral medicine and you may share them with private hospitals. Now, clinically, what are the conditions or the criteria when you consider prescribing the new drugs to the patients? Are there any side effects to such new drugs? Now, as for building subject to compulsory testing, I believe that you are talking about the building subject to RTD. Now, we are conducting PCR tests, and through the sewage surveillance program, we try to identify buildings with possible large numbers of infections. In the recent past, we see that results of sewage samples can give us a very good picture of the infection situation in a certain building. So we target these buildings and we lock them down, and we try to detect the cases as much as possible. Now, in recent days, after a lockdown, we found a large number of infections, and we see that there may be transmission in that building, which may well last some time already. Now, after the lockdown operation has been completed, for those positive cases, and if isolation facilities allow, the residents of that same building will be sent to the community isolation facilities. This can help curb the further spread of the virus within that building. Now, these cases are also newly detected cases. And these are newly detected cases, and their viral load may be low and their risk may be high. Given the limited isolation facilities, we try to give priority to positive cases detected during the lockdown operations. Dr. Lee, about the new COVID-19 drugs, we have procured sufficient stocks. Well, we would prescribe them based on the clinical conditions, the patient's age, whether they have received vaccination, and also the clinical conditions. I cannot make generalizations. Now, as for vaccination for the elderly, maybe I have not made myself clear. The period shortened to 4 weeks. I refer to those recovered patients who have never taken vaccines. Now, after they have recovered, although they have infected, their antibody level and their immunity may not be sufficient enough, so they need to take the vaccine. Now, so the first dose can be administered 4 weeks after the recovery. Now, if the elderly have received vaccines before and have been infected, so they can only take the second dose after 3 months after their recovery. That's the past practice. Sorry, the speaker's not coming through. Okay. Let me respond in writing. Thank you.